Psychological and social implications of visual impairment 2. Introduction. In the previous unit, the psychological and social implications of blindness has been discussed in detail. The current unit takes a teacher trainee further into other aspects that are related to psychosocial adjustment of the blind. Various problems faced by the visually impaired were discussed from the social perspective. It gives a deeper insight on the issues such as mobility, social interaction, and conversational skill of the blind. The psychological issues associated with blindness can never be overemphasized. They undergo several types of emotional irregularities like the feeling of non-acceptance, feeling of resentment, depression, and denial. Such emotions restrict their interaction with the society and make them live in isolation. Visually impaired, as compared to the sighted peers, undergo several adaptation strategies. These strategies can be classified and discussed under the heads of positive and negative adaptation strategies. Also, there are different types of rehabilitation techniques that help the blind become much more independent, socially and emotionally. It includes a mixture of educational and vocational training, creating an environment that helps in adapting to the changing social sphere. Adaptation strategies of the blind. The visually impaired person involves in several adaptation strategies to overcome the hurdles imposed by the social and psychological environment. These adaptation strategies are classified into positive and negative. Positive adaptation strategies. The positive strategies of adaptation are trust, avoidance, acceptance, independence, control, and minimization. Trust. Trust refers to the social support that a visually impaired receives in terms of comfort, strength, and hope. The blind will trust people who understand their emotions and freely interact with such people. They develop trust over a period of time and cannot instantly trust a person as their visual impression is nil. Avoidance. The visually impaired have to undergo several emotional pressures and their psychological state of mind tends to be very sensitive. Their positive adaptation strategies do include their ability to consider the positive intervention and try to think away from the lines of disability. Such people involve in a lot of discussion about their fate, but very soon they try to distract from the current disability and think on positive lines of hope. They involve themselves in some sort of creative activities like music, art, and craft. Some people do simple exercise like walking or yoga that gives them a better way to think about life in a positive manner. Acceptance. The blind people often tend to analyze the levels of acceptance. This means their ability to accept their current situation and trying to live with it. It involves in adapting to the situation and thinking beyond the situation. They often consider the factors that remain unaffected despite their disability, and this gives them the required strength to face the social environment. They learn to nurture newer values and beliefs that are going to govern their living under the current disability. Independence. The most difficult adaptation strategy that requires constant effort from the part of the visually impaired is their independence. Visually impaired often depend on their family or friends due to the inability to view the environment. But a positive intervention in this line is also possible if the person with the disability tries to learn the daily living skills. Right from the childhood days, family and friends need to provide the necessary skill sets that can evolve the blind into independent personality. They must be trained to do the routine personal care and face the challenges posed by life in the same way as that of their sighted peers. Control. Yet another strategy that is mainly useful for people who lose their vision due to some illness. They may be aware of the fact that they are going to lose their vision and it requires dependence on other material factors. They need to get themselves prepared by taking into consideration the various technical facilities that is available for the visually impaired people. Minimization. Visually impaired try to minimize the ill effects of their disability by considering that everybody in the world has some form of difficulty mentally or physically. This makes them take things much more lightly and move forward in life. Negative adaptation strategies. Having understood the positive adaptation strategies that are involved by the blind, it is also worthwhile to get insights about the negative adaptation strategies. They are denial, resentment, shame, isolation, and helplessness. Denial. Loss of vision may be of two types, by birth or due to accidents or illness. In case of loss of vision due to accidents or illness, there is a prolonged level of expectation in the minds of the victim for a permanent cure. Despite repeated treatments, quite often it is not possible to find a permanent cure, and so it is high time that the patient starts realizing the fact. But in many cases, the vision impaired person fails to accept the situation and denies the fact that there is no cure for illness. Hope for cure persists, and this itself becomes a hurdle for further development in life of the visually impaired. Resentment. Failure to do things that the person has been doing all these years is yet another feeling that affects the person's psychological state. He is no longer able to socially interact with people and becomes completely disabled, even physically unable to perform the routine tasks. Their feeling of resentment that such a thing happened to them makes their life all the more miserable. Shame. The blind people shy away from sighted peers as they feel that they are inferior. This complex creates a total barrier between them and their sighted peers. They hesitate to approach anybody as they are ashamed of themselves. Isolation. This is the most sensitive feeling that the blind feels, and as a result totally upsets his social life. The visually impaired people know that they are different from their counterparts who are sighted. This creates a sense of insecurity, and they feel that the people around them are showing sympathy and pity. Such actions tend to affect their emotional levels and thereby creates complete isolation. They are discouraged to interact with the society and thus live in complete isolation. Helplessness. The visually impaired have to depend on their family for support in all aspects, as they lack in daily living skills and are faced restricted mobility. It becomes inevitable to depend on their family or friends. Such a heavy dependence makes them helpless. They have a feeling that they are not fit for nothing and they cannot do anything by themselves. Such negative adaptation strategies are quite common among the visually impaired people. Rehabilitation. Blind people lack in several aspects like social skills, daily living skills, intellectual skills, and many more. But through proper intervention and rehabilitation techniques, it is possible to make visually impaired much more independent. Rehabilitation in its true sense means application of medical, social, vocational, and educational interventions to enable the blind overcome the difficulties associated with blindness. It helps in nurturing the basic skills that enhances the potential of the blind to lead a quality life. Medical rehabilitation. It involves a series of surgical and medical intervention which is done at appropriate time in order to avoid the further loss of vision. In cases of glaucoma and cataract, it is seen that timely detection and proper medication enables in curbing the ill effects of disease. Similarly, a child who is diagnosed at the early stages for some form of vision irregularity, proper medication or supplements can be administered to protect the vision of the child. Besides, there are also different types of medical aids that can be used to enable the low vision people to overcome the difficulty. Such medical aids are broadly classified as optical and non-optical type. The optical devices mainly deal with different types of lenses and other aids that are easy to use and come at different price ranges. They are magnifying lenses, telescopic lenses, several types of projection systems, and the most commonly used reading lenses. They aid the patient in their vision and thereby help them live a much comfortable life. Psychosocial rehabilitation. The psychosocial adjustments that have to be undergone by the blind are plenty. Most of them requires an effort from the blind to understand that they are not inferior to the sighted peers, and a deliberate effort can make them all the more independent. The psychosocial rehabilitation strategies involve 1. Training for mobility, 2. Enhanced daily living skills, 3. Social support. Training for mobility. Mobility is a much restricted factor for a visually impaired person. There are several aids that help the blind move to some extent without much dependence. The most commonly and popularly used method is the mobility cane. It acts as a great friend for the visually impaired and it gives them complete idea about the surface, level and depth. The blind can easily carry the mobility cane along with them wherever they go and also aids in understanding the obstacles that may come their way. This provides certain amount of independence as the textures of the way is also known well by the blind. That is the reason the mobility cane method is still widely used by the blind. Another method is the accompanying of the sighted person along with the blind in cases of crossing the road or boarding a bus and so on. Many sighted people do offer help to the blind to cross any hurdle. There are also other advanced devices like sonic guides or laser canes that come under the category of electronic devices. They are also quite helpful as it gives out sound waves to alert the blind about any obstacles. Some blind people also depend on trained dogs who can guide them through their way. Dogs trained to take the blind to a destination and guide them back to their homes are quite helpful as dogs have a great sense of remembrance. Daily living skills, also known as the survival skills. These are the routine tasks that need to be performed by anybody. Sensory stimuli play a vital role in providing training on daily living skills. Common routine activities like eating, dressing, toilet training, shaving, taking bath, body hygiene maintenance and cleaning has to be trained so that they can perform all by themselves. Visual impairment causes low confidence, and when such training are provided at the right time, it helps in coping with the difficulties of blindness to a great extent. Social support. Society plays a major role in grooming the life and personality of the blind. Family support is important, but only with the extended support of the society can the blind come out of his house and lead a normal life. Only through continuous support in the social sphere can the blind overcome their inferiority complex and feeling of insecurity. The society must accept the blind with open hearts and encourage them to interact with the social peers. Social functions are a common ground wherein the blind and the sighted can interact. Such functions must be organized and the blind must be encouraged to participate in them without any hesitation. It is better to avoid the showering of pity and sympathy as most of the visually impaired are never ready to accept. They like to be treated as a common man and give them all the freedom that any sighted person gets. However, the society must provide with the required assistance wherever the blind yearns for. The friends and relatives of the blind can try to enable the blind to regain their self-esteem. Quite often, the blind faces depression due to their inability to interact in the social environment. But with the support of the friends, the blind will be able to cope up with their disability and lead a normal life that is characterized by psychologically strong mind and socially amicable atmosphere. Educational rehabilitation. The educational rehabilitation is made possible by many special schools that are located in various parts of India. This provides different avenues for the blind to test out their potential and thereby become a basis for their career growth. The primary education system is taught in most of the schools, and then they carry on with their regular schooling systems aided by special devices to cope with the competition of the sighted peers. Some of the devices that are used in educational institution for the blind include Braille. This is the most commonly used device and proven to be the most powerful educational tool. Louis Braille was the inventor of the Braille, a special education system developed to assist the blind. It was invented in the year 1832, and all these years it has been serving the blind with unconditional education support, broadening their intellectual sphere. The system is based on letters that are formed in dots, creating letters that can be touched by the blind. Braille comes with 6 dot cells that can be combined in several ways, as many as 63. It is a great handy device that guides through the language easily for the blind. Writing devices. Similarly, based on the Braille, nowadays Braille slates are also available. This aids in writing work for the blind. The blind people will have to punch in dots in a specified pattern, like right to left. Then they are required to turn the paper and touch the dots from left to right to read the same. Stylus is also given along with the Braille that helps the blind to punch the dots on the cells. Another advanced device is the Braille typewriters that are specially designed for the blind, and it works on the same lines as that of a Braille slates. Only difference is that the typewriter types in the words directly, and there is no requirement to turn the paper for reading the same. Mathematical instruments. Abacus helps in a great way in assisting the blind in making mathematical calculation. Geometrical instruments are also equally used to understand the nuances of the subject. Besides, tailor frame is yet another instrument that is also widely used in aiding the blind in learning mathematics. Vocational rehabilitation. Vocation, as the term clearly describes, some form of earning that the blind can do by involving in some activity. This rehabilitation technique makes the blind financially independent. The blind can also involve in simple activities by which they can earn money and meet their life's demands without much dependence. Some of the common forms of vocation include candle making, caning of chair, book binding, chalk making, and similar other activities. Training can be provided to make them excel in such areas which overcome their inability to see. Some also involve in maintaining a STD and local PCO booth, and so on. Voice-based processes in many of the companies also encourage the employment of the blind. Some of the visually impaired also take up vocation as radio jockey, which is purely voice-based. Their ability to talk and interact with people over the phones can be effectively used to make programs interesting on radios. The government is taking up all forms of measures to encourage the visually impaired. Government jobs are provided with reserved quota for the visually impaired. Government jobs come with a lot of benefits like retirement benefits and job security. So, reservation in such jobs boosts up the confidence and self-esteem of the blind in many ways. Besides, government also has instilled several telephone booths that provide effective employment for the blind. Many of the visually impaired are selected based on some criteria and given special training and then absorbed in several government institutions. Rural Ministry of India have evolved a scheme wherein at least 3% vacancies are reserved exclusively for disabled people to engage in rural development arena. With so many schemes, the government is also considering several measures for the upliftment of the visually impaired people. Conclusion. Several rehabilitation strategies have been clearly depicted in the current unit, which gives a clear idea about the current scenario faced by the blind. The negativity that penetrates into the minds of the blind is to some extent overcome by such timely interventions. Understanding the visually impaired and their difficulties enables the people in the society to assist in their daily living in several ways. Their attitude of pity has to be replaced with acceptance, which in turn gives positive motivation to the blind. It also creates a sense of normality and an urge to interact with the society rather than settle in isolation. Government, along with the society, can play a major role in chalking out special place for the visually impaired in every arena. By giving them the opportunities to shine and perform, creates confidence for the blind, and they will be encouraged to overcome their disability and perform even better. The reservation provided for the blind is a great way of emphasizing the sense of acceptance and treatment of equality that goes a long way in nurturing the positive thoughts in the minds of the blind. With the changing times, there are several newer devices and strategies that are brought up to assist the visually impaired to lead a normal life. Though the difficulties faced by them in the form of life's challenges are several, such rehabilitation strategies greatly help them to live the life to the fullest.